Question number 1. A man, 65 years of age, developed pain and stiffness in his knees, which progressively got worse over a span of 7 years following an injury. He has lost some flexibility of his knee joint and experiences a grating sensation upon movement. What condition is he suffering from? A. Osteoarthritis, B. Rheumatoid arthritis, C. Gout, D. Psoriatic arthritis, or E. Ankylosing spondylitis.
A.
Yes, the answer is A. Question number 2. A postmenopausal woman with incidence of knee pain was diagnosed with osteoarthritis on X-ray. Which part of a joint does this type of arthritis usually affect? A. Bone, B. Cartilage, C. Tendon, D. Bursa, or E. Ligaments?
B.
Beta.
Yes.
B.
The answer is B. 3. Osteoarthritis, also known as degenerative joint disease, is the most common type of arthritis. Inflammation or injury to the joint can cause bony changes, deterioration of tendons, ligaments, and a breakdown of cartilage, resulting in pain, swelling, and deformity of the joint. Which of these makes it more likely to get osteoarthritis? A. Young age, B. Excess body weight, C. Too little body weight, D. Back pain, or E. Being African American?
B.
B.
B. Yes, the answer is B. 4. A 40-year-old obese man with poor drinking habits developed pain and swelling in the big toe. Upon visiting the doctor, he was diagnosed with gout. What is the first-line therapy for gout? A. Propionic acid, B. Allopurinol, C. Febuxostat, D. Benzobromarone, or E. Panadol?
B.
B.
Yes, the answer is B. Question number 5. Based on the previous scenario, pharmacological therapy can be initiated after how long once the acute gout attack has taken place? A. After 48 hours, B. Within 1 hour, C. Within 24 hours, D. After 24 hours, or E. After 2 days?
C.
Yes, the answer is C. Question number 6. A 60-year-old man with 15-year history of seropositive polyarticular rheumatoid arthritis is currently treated with prednisolone 5 mg daily and methotrexate 12.5 mg daily. He is diabetic and treated with oral hypoglycemic drugs. For the past 3 weeks, his right knee has become progressively painful. Examination shows warm synovitis and obvious knee effusion in the right knee with stress and pain. The left knee shows no synovitis. The other affected joints in his hands, wrist, elbow, and forefeet show some minor abnormalities but no synovitis. Which of the following would you do at the clinical visit? A. Admit the patient straight to the ward. B. Aspirate and inject the right knee with steroids. C. Take blood for C-reactive protein, full blood count, ESR, and await results until the next clinical appointment. Or D. Increase methotrexate to 15 mg weekly and offer the patient a steroid injection into the knee. Or E. Undertake an X-ray examination of the knee.
C.
Yes, the answer is A. Question number 7. Rheumatoid arthritis should be suspected in patients with polyarticular symmetric arthritis, particularly if the wrists and 2, 3, 2nd and 3rd metacarpophalangeal joints are involved. Alternative diagnoses should be suspected in which of the following? A. Patients with subcutaneous rheumatoid nodules. B. Patients without distal interphalangeal joint symptoms. C. Patients with prominent lumbar symptoms. D. Patients with low RF titers, or E. Patients with fever above 100 degrees.
B.
No, the answer is 7C. 8. Rheumatoid arthritis is a relatively common autoimmune disease with multiple treatment options. Which of the following is an example of a drug class that has been shown to halt or reverse the progression of this disease in most patients? A. Aspirin, B. Azithromycin, C. Everolimus, D. Methotrexate, or E. Prednisone?
E.
D.
The answer is D. 9. Ankylosing spondylitis is a form of arthritis that causes chronic spine inflammation. It inflames the sacroiliac joints located between the base of the spine and the pelvis. What does it have in common with psoriasis and Crohn's disease? A. They're all contagious. B. They're all autoimmune disorders. C. They're most common in South America. D. They have prominent skin symptoms. Or E. typically found in children?
B.
Yes, the answer is B. Question number 10. A 50-year-old woman having variation of the HLA-B gene has developed inflammation of the sacroiliac joints located between the base of the spine and the pelvis. The doctor said having ulcerative colitis also increases her risk of the condition she is suffering from. What type of arthritis has she developed? A. Osteoarthritis, B. Rheumatoid arthritis, C. Gout, D. Psoriatic arthritis, or E. Ankylosing spondylitis.
B. B.
No, the answer is E. This is the key. These are my references. And thank you.
Thank you very much, Dr. Reda. Very nice presentation. And the most important part is that all the arthritis that are very important and common in our community, they have been covered. And the most recent things, especially in recent advances like DMARDs, they have been simplified and presented in a very easy way. If you please stop the recording, I want to discuss few important things that we must have in our presentation. Please.
Okay, ma'am.